Most population-based studies confirm that hypertension increases an individual's risk of various cardiovascular consequences approximately 2 to 3 times. The prognostic value of adding atorvastatin to amlodipine in hypertension is undeniable, but the true benefits can only be realized if the patient adheres to the medication. Multiple drug regimen, along with socioeconomic and psychological factors, is a strong determinant of poor compliance leading to poor control. In a retrospective cohort study, more than 64% of patients were not adherent to separate antihypertensive and lipid-lowering medications at 6 months. When adjusted for age, sex, and other measured variables, the strongest predictor of adherence with concomitant therapy was the number of other prescription medications. Thus, physicians can significantly improve adherence by reducing pill burden. High Noon Laboratories Limited proudly introduces the combination of amlodipine with atorvastatin in a single pill, avotin, engineered for the compliance you want and the control your patient needs. Avotin improves adherence to the treatment. As proved by this study, where patients taking amlodipine and atorvastatin in one pill were 2 to 3.5 times more adherent at 6 and 12 months compared to those patients taking 2 pill regimens. Avotin also provides effective 24-hour ambulatory blood pressure control in systolic and diastolic blood pressure. Avotin ensures compliance due to the established safety profile of amlodipine and atorvastatin. The side effects which patients experienced with amlodipine and atorvastatin were comparable to placebo. Along with this compliance, avotin provides the control of cardiovascular events in hypertensive patients. As proved in ASCOT trial, adding atorvastatin to an antihypertensive treatment provided 36% reduction in non-fatal MI and fatal CHD. However, when atorvastatin was added to amlodipine, the reduction in non-fatal MI and fatal CHD was 53%. Avotin improves compliance in diabetic hypertensive patients. According to the National Health and Nutrition Examination Survey data, 65% of patients with diabetes are not at JNC 7 goal of less than 130 by 80 mm of mercury. They need more. Amlodipine is an effective add-on. According to American Society of Hypertension, calcium channel blockers have a beneficial or neutral effect on insulin sensitivity and glycemic control. The 2010 American Diabetes Association guidelines strongly recommend statin use in diabetic patients, but they are burdened with pills. According to American Diabetes Association, the average person with diabetes takes 9 pills a day. Adding another pill in these patients is really a challenge. In diabetic hypertensive patients, avotin provides control by offering significant reduction in cardiovascular events. Patients with angiographically documented coronary artery disease without heart failure experienced 42% reduction in hospitalization for angina and 27% reduction in coronary revascularization in CAMELOT study. In CARD study, diabetic patients experienced 37% reduction in major CV events and 48% reduction in stroke with 10 milligrams of atorvastatin. Avotin is a single pill that offers multiple benefits when compared with amlodipine alone. Avotin is indicated to reduce the risk of MI, whereas amlodipine alone is not. Avotin is indicated to reduce the risk of stroke, whereas amlodipine alone is not. Avotin is indicated to reduce the risk of hospitalization in CHF patients with CHD, whereas amlodipine alone is not. Avotin provides impressive reduction in LDL-C, whereas amlodipine alone does not. Avotin lowers both blood pressure and cholesterol, whereas amlodipine alone does not. Avotin is engineered for the compliance you want and the control your patient needs. Avotin is indicated in patients for whom treatment with both amlodipine and atorvastatin is appropriate. Here are some happy tips for patient selection. The amlodipine component of Avotin is indicated in hypertension, chronic stable and vasospastic angina, and angiographically documented coronary artery disease. The atorvastatin component of Avotin is indicated in prevention of CVD, heterozygous familial and non-familial hyperlipidemia, elevated serum triglycerides, primary dis-beta lipoproteinemia, and homozygous familial hypercholesterolemia. Avotin, however, is not recommended in patients with active liver disease, unexplained persistent elevations of hepatic transaminases, women who are or may become pregnant or who are nursing, and patients with hypersensitivity to any component of this medication. Avotin is definitely engineered for the compliance you want and the control your patient needs. Avotin offers true benefits by increased adherence to the medication. Avotin provides an effective 24-hour blood pressure control. Avotin is an effective add-on therapy for diabetic hypertensives. Avotin provides greater reduction in the risk of CV events by offering high noon quality at the right price. Based on these benefits, prescribe Avotin for better prognosis to your diabetic hypertensive patients not at goal, to your hypertensive patients treated with amlodipine, and to your newly diagnosed hypertensive patients. Thank you very much for your attention.